Welcome to What the Flip. I'm your host, Victor Vogel, and I'm rebroadcasting this. I tried it earlier at 7 p.m., but I ran into some mic technical difficulties, so I don't. I think I have those solved now, and we can move forward. I'm just going to redo this broadcast so that it can actually be aired properly. So that's sort of what we're trying to do right now. And I'm just trying to make sure everything is all set up here. And we'll get going here in just a second. And make sure we're all set up and I'm working on my Facebook here to make sure I'm coming across on Facebook. And that we're all in the right spots, doing the right things. And that ought to do it right there. In a second, I should be popping up live. Looks like I am here live. Okay, so great. Just make sure. There we go. Oh, yeah. Silence that so we can see. All right, we're all set to go now. Just wanted to take a few minutes to tell you that this will be on the Facebook page, and you can go there and visit the video section and the whole under series. There's a series name in there called "Attack on America: The Healthcare War," and you can get on there and you'll be able to basically see all of the videos before this one plus this one. So this, of course, is based on a study done by the Brookings Institute, and I'll put that link in the last video I do, so you can go look that up and take a look at it. If you're interested, you can make comments, and the comments, if you join me on my Facebook page, you can actually go in and click on the video and watch the video live while we're doing it and make comments while you're doing it. Just type in your comment and it'll show up in our little comment section that kind of comes in, something like that. I think it won't have that StreamYard logo on it. It'll come across just basically as a Facebook comment. So tonight we're going into Fact 7 just to enhance a little bit. So to kind of catch you up, if you haven't seen any of these, we had a segment just sort of introducing it and telling you how much money we were actually spending, and of course how that compared to other countries or the democracies and operating under a free economic system. And we saw we didn't compare too well. We were spending a lot more than they were. Of course, nearly every other country has gone to some sort of Medicare for all or single payer program in their country. We're probably the last holdout on that issue. And consequently, what's happening is where we have government comparisons, financial comparisons, where the government spends money, which in our case is Medicare, Medicaid, that kind of stuff, we're very comparable with the other cost structures of other countries around the world who are both democratic and a free economy, a free capitalistic economy. where we differ is we have a segment added onto that where private insurance is paid. That's where you pay your insurance. If you are not on Medicare like I am, you have to pay your insurance through your employer or privately, wherever. And it's those costs that shove us way above the rest of the world, or at least the rest of the democratic countries we compare against that are similar to us in terms of costs. We exceed them greatly. And it comes at that private cost structure. And then we looked a little bit about where does that break down, and that we found that it was mostly in hospitalizations or hospitals, the cost is in hospitals, and professional services segment. Those are the doctors, lab tests, those kinds of things. And we then talked a little bit about, how that breaks down across the country in general, how it spreads across the country, the varying pricing structure, varying degrees of differences in costs in the country. And then we broke that down even further into the cost of people based on how healthy you were, from excellent to poor. And then we went a little bit further in this segment, and we were talking about how the disparity in cost. We also looked at healthcare relative to that percentile, from like the 90th to 100 percentile group of spending versus the 10% group of spending, how those are spread out across age categories plus health. So we've covered a lot of information about how our healthcare is, what it costs and what is involved in that cost. And today we're going to look at just a little bit further disparity between cities. just some examples of how we're, this healthcare system is such a train wreck. I don't even know how we keep track of it. I don't know how we understand how we charge what we charge or where the expenses go. A lot different than Medicare. You can track all of that in Medicare. It's very easily tracked, and I'll lay out some comparisons about that as we go through this. So let's just quickly jump into sharing my screen here with you so we can see that cost. There we go. So right now, you're looking at question or fact number 7. And what fact number 7 says, and just to go over the previous 6 facts, I think they're all here. The first fact was U.S. per capita healthcare spending nearly quadrupled from 1980 to 2018. Fact 2 was U.S. healthcare spending is almost twice as high as the OECD average, which are those countries we compare against. Fact 3 was most healthcare spending is on hospital and professional services. Yet we're really, emphasizing drug costs, reducing drug costs, and that's good because people in the lower income, the lower end of the middle income bracket, and the lower income bracket, that's very good for them because it helps reduce their everyday living. But it is only 9% of the cost of healthcare compared to the 50-some percent between hospitals and professional services. Healthcare spending per privately insured person is 3 times higher in some parts of the country than others. We saw that. And now we're beginning to see in many cities healthcare prices vary widely. And we're going to look at a chart down here in just a second. Kind of want to introduce you here to that chart with this paragraph. and then we'll go take a look at the chart and just kind of talk about that a little bit. In a well-functioning competitive market, prices for same services will not vary within a given place much. Consumers will avoid businesses that charges much higher prices than, say, its competitors. So that's our free market economy. It's based on the fact that price regulation is based on supply and demand, and we will alter that supply and demand if we feel like it's out of whack by not purchasing the higher products, at least same products. However, many healthcare markets dramatically violate this expectation. And figure 7, which we're going to look at in a second, focuses on healthcare price variation within selected metro areas within the country. We don't look at all of them, but just a few just so you can understand what's going on. We're showing some of those metropolitan statistical areas feature much more price variation than others. For example, estimates from the Healthcare Cost Institute show that the price for a blood test ranges from $22 in the 10th percentile bracket. That's the healthier individuals who tend to spend less on healthcare, all the way up to $37 in the 90th percentile bracket in the city of Baltimore, Maryland. Now, that's not a whole lot. That's like a $15 difference between the brackets and the percentiles. But in El Paso, Texas, the same range is $144 to $952 for the $144 for the 10th percentile bracket and $952 for the 90th percentile bracket. So you're seeing that just between these two cities, the increase in cost between the two cities for both brackets is phenomenal between Baltimore and El Paso. But even within El Paso, the spread between 144 and 952 is so much larger than Baltimore and Maryland, between $22 and $37. So, let's take a look at that for, in terms of the blood test down here. This is the blood test. This is your basic blood test. You can see here in Baltimore, not a lot of spread. You come down here to El Paso and look at here. Look at the range of prices within the city of El Paso. And then look at the difference in costs between the prices in El Paso and Baltimore. Baltimore, Maryland, that's a major, East Coast, New England, Northeast, East Coast city. You wouldn't be thinking that cost structure in El Paso would be so much higher than Maryland, but it is. And it is also a much wider spread within the city itself. Okay. And this was, it looks like this was like a 2019. Yeah, source was in 2019. So this isn't too far off. Now, they did the same thing for a C-section for these, and you can see the variance for the C-section between Knoxville, Tennessee is not very big, but when you come down to San Francisco, a C-section is so much more expensive there than it is in Knoxville, Tennessee. And there's not a lot of widespread in Knoxville in terms of your health level, but down here in health spending, but down here in San Francisco, if you're spending a lot more for your health care, you're paying a lot more for your health care at the same time. And so there's a lot of variance. So this is kind of an interesting and messed up kind of scenario when you think about it. So it's about 9.3 times larger in San Francisco than in Knoxville. So some variations in prices due to differences in quality and amenities. One medical practice might take more time with your patient, have nicer facilities, or employ more experienced medical teams, allowing it to change, correspondingly charge, not change, but charge correspondingly higher prices. But much of that variation is likely related to market imperfections that limit the ability incentive for patients to shop for lower prices. And this is what I was saying throughout this process, trying to ascertain the cost up front is phenomenal. You can get a projected, in fact, they encourage you to get a projected costs for whatever procedure you're going to do, whether it's medical, dental, or whatever. And you can probably get a pretty accurate cost of what that procedure is going to cost you. The problem is if you ask, why is it that cost? What are you doing? And how does that compare to the state next to me? Detroit versus Brighton, Michigan. How are those prices varying in cost, and how do they compare against other places that are doing this? And you'll get a lot of resistance to answering that question. It just is very, very difficult to get those answers out of insurance companies and out of hospitals and doctors and other people in those programs. So this is pretty phenomenal to me. This is pretty phenomenal from the standpoint it shows this healthcare system we have is nothing but a train wreck. You can't project how much anything is going to cost you in the long run when you are involved with this. It's very, very difficult. Very, very difficult. I know I tried on my hip surgery. I couldn't get any straight answers from anybody. Relative to how much my hip surgery was, I could call around the country, I guess, if I wanted to, and ask, to get some sort of cost structure on it. And I think what I would run into is what we saw right here in this study, just a lot of variance in all of that. So it's difficult to live in that scenario. Now, what you don't see, I mean, that's private. Most of that has to do with private insurance, people spending money on their private insurance, whether it's deductibles or, the variance and deductible and the price and the structure, what's covered, what's not covered in insurance. Now, what is interesting is Medicare has this down pretty much to a good science. They have a fixed price, and they charge that fixed price no matter where you are in this country. And that's what doctors are going to get. And doctors more and more are signing on to that because, one, obviously, the 90th percentile of people using their services in that 90th to 100 percentile bracket are the people that are earning them money. And that is your older folks, and they happen to be on Social Security. So what's happening then is better to tap into that larger group of people and get, 33% of what you would charge in a private, private insurance company, It's easier to get that money from Medicare because it's almost a guaranteed payment process, no problem. So Medicare basically negotiates a standard fee structure across the country for all services, and that's why they're so efficient and effective in running their system. And that's why private healthcare companies are wanting help Medicare to help them understand how to do that, how to set up that plan. So they're actually asking Medicare for them to teach them how to do what Medicare is doing, which is socialized medicine. And it is a single payer system. And so, what private insurance companies are saying, teach us how to do that so we can bring the price structure down, make more money, etc. Medicare doesn't make money. It's not a for-profit organization. And this then points out the real problem with our healthcare system. You cannot have a healthcare system that is focused on a free economy, a capitalistic approach to it, a for-profit organization, because that's what's happening with hospitals and why they're costing so much more. They are starting to become conglomerates. You have large numbers of them coming under one umbrella, and then they set up a fixed structure, and then they suck in doctors if they want to have any hospital, particularly in rural communities. If they want to have any hospital service, they have to belong to that hospital system. And then all of a sudden you're sending all your lab tests and everything through them. It's not bad for the doctors because, in fact, they don't have to deal with any of the billing or processing. The hospitals handle all that, and then the doctor just take their cut out of that. So it's kind of reversed. In Medicare, the government negotiates, and the doctor gets paid directly from the government. So if they were operating, if hospitals and insurance companies were operating like Medicare, that's how doctors have a set fee. They just get paid by the insurance companies and the hospitals, but they don't. It's a very complex formula. There's a lot of give and take. Negotiations are difficult and at times just baffling. So that's what's happening with the healthcare system under a private organization. The Medicare program is doing just fine. We're competitive with other countries. It costs a lot less than private insurance does out there. It's not the Medicare is really not costing employers in terms of having to pay a percentage of health care for employees. They get a tax part of the tax structure along with the employee that goes in and funds some of the Medicare, but it's nowhere near the same price you pay for your insurance privately. I mean, my Medicare insurance is just phenomenally less than private insurance. So that's what's going on in this system. Kind of picking this apart, I want you to see this as we go through it so that you can get a sense of what's actually going on. And in fact, what's happening is these hospitals are moving to more urban areas, and with them, they're drawing in all the specialists to the urban areas, because you can see, like for San Francisco, the widespread there and the higher costs for a C-section. That what's happening is that brings them more money by being in an urban area where more people are there and the need is the greatest. Consequently, the rural communities are just getting deprived. I mean, they're losing all of their good quality health care, which move in with these conglomerate hospitals all over. So that's another dilemma that's part of the train wreck. No one Not everybody is getting this really good quality service. And then here's what happens under this situation. So Donald Trump has decided he would make the United States a favored nation country, which means they can buy drugs anywhere in the world at the lowest price that the lowest person selling at. So that's why in Canada, you might get insulin for $20, whatever. I'm not sure what it is, but then a comparable figure would be 120 here in the United States. So what Trump said is, hey, look, I'm going to set this up so everybody can buy their drugs from Canada or anywhere else. And the problem is what he wants to happen here is he doesn't want to fix the healthcare system. He wants us to be able to go and buy Canada's, for example, drugs at their prices and bring them back in here in the United States and use them here, because we can't manage to get our drug prices down to do that here in the United States. Well, Canada did get their drugs down, and then they want all of a sudden with their needs, they're meeting just fine. But with the influx that Trump is saying is, hey, now you can go to Canada and buy all your drugs. That'd be fine, except all of a sudden some of the critical drugs over there could be depleted so fast that Canadians wouldn't have access to them. So Canada has put a restriction on buying drugs in Canada. So already that program is all messed up because they hadn't thought through all of this. It was just like, oh, you've got to give us your drugs too. That's how Trump is trying to build a healthcare system. And instead of fixing it here and doing the right thing to fix it here, he's trying to appease the hospitals and the pharmaceutical companies and everybody who contributed to all of the Republican Party's election systems to keep this stuff in place so that they can maximize their profits as a hospital. And the dilemma with that is you don't have a choice. It's not a free economy because what happens is you don't have a choice. If you have a heart attack, you don't have the option of taking the time to go out and select the hospital you want to go to, determine the pricing between the doctors that are going to work with you, negotiate the labs and whether they should be done in the hospital, outside the hospital to save money and without sacrificing quality, all of that kind of stuff. Okay, you don't do that. You go to the hospital that's closest to you and you get help so you don't die from your heart attack. You do not have an option. It's not like buying a car at your convenience. It's not something, car is pretty important. It's not something you have to survive. Nor is a computer, nor is lipstick, nor is cologne, nor is a lot of other products, computers even. A lot of other products out there that people can do without, and now you can negotiate those on a free market basis based on selling, buying the demand and supply scenario, but not healthcare. Healthcare is not a demand and supply. It's a random scenario. We saw that in one of the other videos I did about how the costs was spread. Like, yes, it's higher for those people in the 90th percentile bracket who are a little older and have a little more ongoing healthcare problems, but they're not all of them old. There was some of that down in people who were healthy, but all of a sudden were diagnosed with cancer or got in a car wreck and were crippled or something like that. And those expenses go up for those people. They all of a sudden move out of the 10th percentile bracket into the 90th percentile bracket, and they're younger. So these are things that really get in the way of us having a capitalistic approach to our healthcare system And that's why it's broken, because nearly everybody else has discovered that, that doesn't work. They change their system to a single payer or Medicare for all or government run or some sort of hybrid of that that, really works for everybody, and they made it mandatory across the country, so doctors didn't have a choice. Well, if they did that here, you don't have to worry about your doctor leaving, because where's he going to go? Every place else does that. So he's going to just stop practicing medicine. I don't think you're going to find a lot of doctors who feel like they can afford to stop practicing medicine. First, they got a big loan to pay off in school, but they don't, they're not going to earn that kind of money. They don't know anything else. I mean, I guess they could become stockbrokers or whatever they want to do. They might make what they made as a doctor, but you're not going to see a lot of doctors moving out of their fields. They're not going to give it up. They're not going to give it up. So I think you're going to need to understand enough about this to make some good, hard decisions about who you want to support in your health care. Think not from the standpoint of Republican, Democrat, or socialist or capitalist. Don't think in those terms. Those are aggravating terms that people throw out there to create hate division. Think in what happens if I'm walking along, slip, or I'm riding my bike, I hit a bump, fall over, crack my hip, and all of a sudden I have a $75,000 doctor bill in my private insurance program. How is that covered? How much of that is covered? And think ahead about this. Don't wait till it happens. Think ahead about this. Do a what if scenario. A lot of corporations do this in strategy. The military does it. What if scenario. What if I fell and fractured my femur right at the hip where I did, and you had to have a full hip replacement? That's a $75,000 bill. Maybe more if you live in San Francisco or New York or the East Coast or El Paso. It could be 150, 200,000. And if you don't have Medicare, which basically negotiates that down to 25,000, and then pays a big chunk of it, that's kind of what we need. I don't think we're going to get less health care. I mean, too many other countries are experiencing advancements in medicine the way we are. We'd like to think we are the best in the world, but there's nothing really out there saying we are. We just have that big head attitude. A lot of data says differently in a lot of situations. So now there are a lot of other countries that, are poor that this would be a better country to come to, but not all countries. I mean, they could go to Europe too. So I'm asking you to just look at this because this is topics that are going to be coming up. This is topics, if you're in Georgia, folks, you need to seriously be thinking about what you're going to do with these two Democratic senators. Because if you want to stay stagnant on health care, the Republicans are going to do everything they can do to block Biden, which means you're going to have 4 years of no movement whatsoever. And then after that, they don't have a program. They haven't had for 4 years. They haven't had one before that, 8 years. You haven't seen one. All you've seen is this train wreck we have dumping more money into the upper echelons of hospitals. Okay, so, you probably want to seriously consider given Biden control of the House and the Senate so we can move off of where we are and do something about this healthcare system that will benefit us all, not just a few people. Everybody up there in Congress is not worried about paying for a hospital bill. They're currently not even worried about where you pay your rent or not. So I would suggest that if you're a Georgian and you're struggling and you're worried about, what would happen if I got sick in the middle of this pandemic, and either with coronavirus or even if I didn't have coronavirus, but I couldn't go to a hospital and get what I needed treated because the hospitals are full. This is all under the Republican program. The stimulus was in place in May. There are 6 months of $600 a week, $2,400 a month for 6 months that could have been in people's pockets, could have helped support small businesses. 6 months of this, we've been struggling with this. And you can say, well, the Democrats are holding out. We want to get five. Well, what you wanted to give them was nowhere near what would have been even acceptable to get out of this problem. And then you want to protect all the big businesses so nobody can, sue them if they make you come to work when you don't want to come to work and it's not healthy and you got coronavirus everywhere. So I am simply saying this. A bill similar to the one that was passed in April could have been passed back in May that would have provided money for a long time. There could have been a lot of money in people's pockets. And it would have kept this December 31st date from happening. Okay, so it just doesn't make sense. So in Georgia, and you're watching this video, folks, you need to vote your 2 Democratic senators in so we can move on stuff. They certainly haven't done anything up to this point as Republicans. And if they're telling you they're going to, pretty sure they're lying because they haven't done anything in the past for the last 8 years. They certainly haven't done anything for the last 4 years under Trump. So this train wreck, I'm going in this train wreck because you have an opportunity to look at this healthcare system. It's going to take you making some tough choices. I'm not saying you have to go vote for Democrats if you're a Republican. I mean, if you just can't stomach that, that's fine. Just do what some Democrats did in the past when they couldn't vote for some of the people they saw running, and that is stay home. Just don't vote. Just don't vote. If you can't vote for the right thing, then it's better you just don't vote. And you know what's right. I mean, too many Americans know what's right. Okay. Please wear your mask. Socially distance. Just don't go out. Don't go out and spend money in restaurants. Don't go out. It's not so much spending money in restaurants. Just don't go out and be around people in restaurants. Don't go out in public areas and congregate. For the next 4 months, please just hunker down and stay home again so we can bring the virus down, reduce the amount of people we have to provide vaccines for, free up hospital beds so other illnesses can be treated and people can get their health back. And that requires you to do a simple thing. Put on a mask, wash your hands, and stay away from large groups of other people you don't know, you haven't been around or living with. Okay? if you don't do that, you're just going to delay this even longer. The doctors have been right. They were right in May. They were right in July 4th. They were right in Labor Day weekend. They were right when people tried to send kids back to school and they kept closing school and sending them out because they didn't do it right. And, we're learning little bits at a time, but we're taking 5 steps backward for every 1 step we go forward because simple thing. Somebody won't put on a mask. Somebody won't put on a mask. They just don't want to do it. Sorry. That's just selfish. That's just pure selfish. But more importantly, it's stupid on your part because you've seen what's going to come. So here we go. We're waiting on Thanksgiving to hit us, and that's going to hit us just about the time just before Christmas. People are going to get hit hard again. That's a hell of a time to have people hit hard with coronavirus because you didn't want to stay home. You didn't want to wear a mask. Not to mention the deaths that we're going to experience. All right. This is Vic Vogel. This is What the Flips podcast. And sorry about the 7 o'clock session. This is the same presentation. I encourage you to share this with your friends and neighbors because, healthcare is going to be on the docket this year. And if we don't have the Senate, we're still going to have to convince Republicans to vote on something they said they just wouldn't do because it's Joe Biden and Democrats that is going to hurt you very bad. And you're going to have to tighten down the hammer on these folks or tighten down the nut on these folks and get them to wake up and realize their jobs in Washington depend on taking care of you. But the best thing to do is put those 2 senators in that position so we can start getting some things done real quickly. I promise you, you will not have near the money that you need right now in Georgia or this country if those 2 senators are not put into place. If Ossoff and Warnock are not elected in Georgia as Democratic senator, gives control of the House and the Senate, you will not have a large stimulus bill. You will not have one big enough that you need. The only people talking those languages are Joe Biden and the Democrats. The Republicans are not talking that language at all. They have been your barrier for 6 months. You don't need any more evidence than that. Okay, you have a good evening. Hope this is helpful to you. Either way, maybe you'll make some better healthcare decisions and understand your healthcare a little better about what's going on. Enough for you to start researching and try to figure it out. You have a great evening. Next session will be Monday. Monday I'll be doing this again, and you can check in. You're free to put comments in during these sessions. If you come to my Facebook page, click on the post that has the video in it, and just the video come on screen, and you can actually type your comments in right in there, and they'll show up on the video on the screen here, and we can, put them on there if they're, reasonable and not offensive to people. We can put them up, and then we can take a second and discuss them during or after the presentation. So that's always available to you. Have a good evening.